for Forest.
Thank you, Deputy Speaker. As the co-convener of the Parliamentary Friends of Endometriosis with the member for Bendigo, we work to raise and increase awareness of endometriosis both in this House and in the communities and wherever we possibly can. But I do want to acknowledge the suffering, the crippling pain and the impacts on the lives of to some people it's 1 in 9. Recent research show it could be as low as 1 in 7 women. So what the prevalence is increasing, that advocates are now saying are suffering from endometriosis. I understand that the rate of hospitalisations has doubled amongst women aged 20 to 24 in the last and past decade. As we know, it is a progressive and chronic condition for which there is currently no cure. I want to acknowledge my colleagues, the member for Boothby and the member for Canberra, previously in this place, who worked closely with the coalition government to develop and introduce the first ever in the world National Action Plan for Endometriosis, with record funding directed to improve diagnosis and primary care support, to help more women find appropriate care and better manage the impact of endo on their lives, their family and social and work and study. In that 22-23 budget, the Coalition announced funding for 22 new specialised endo and pelvic pain clinics in every state and territory. And this commitment was the largest ever investment in endometriosis treatment and research in Australia. I'm pleased that the Labor government has continued with this policy and have introduced the pelvic pain clinics. But you could understand that I'm particularly and desperately disappointed and frustrated and hurt for the women in my electorate that there is not one in the southwest of WA, one of the most fastest growing regions in Australia. I've shared my daughter's very personal endo experience previously, and I'm constantly approached by women who are doing their best to live with endo every day. I have the greatest respect for their courage and their determination of these women who literally live and work with endo every single day. The excruciating pain, the lower back and abdominal pain, the exhaustion, the bloating, the nausea, and far too often the fertility problems. Recently I heard from an amazing young woman, Brooke Gibson, who lives in Bustleton. She's overcome so much in her endo journey, but has refused to let the debilitating effects stop her from being a proud member of the South West Jets League side playing in Western Australia's Netball League. She's also studying to become an occupational therapist, but she's grappled with endometriosis. It took her many years to actually receive a definitive diagnosis. Unfortunately, this is not uncommon. It's often 7, 10 or more years, by which time the damage caused is well advanced and sometimes irreversible when the actual diagnosis is made. Brooke says her greatest struggle was with the health professionals who simply did not understand endo or who had not been educated to diagnose endo. In the first speech I did in the Parliament on endo, I asked every GP and health professional to take these young women seriously, please. I know it can be difficult to diagnose, but for goodness sake, I asked them, can you please take these young women seriously? Or send them to an experienced gynaecologist who actually specialises in endometriosis. Now, Brooke is just one of the young women who would have benefited from a dedicated pelvic pain clinic in the southwest of WA. And there is absolutely no doubt that the struggle to access or receive accessible treatment and care is much more challenging and often impossible in regional and remote parts of Australia. And of course, I just wanted to say a special thank you to every young woman and mature-age woman who's realised later in life that she has endometriosis. And I want to say that the clinics themselves need to really be able to deliver, and I want to see much more pelvic pain education in schools so that our young women know what is not normal and when to seek the help that they need to get it early in their lives so that they don't have to suffer in the way that so many others before them and right now are suffering. And as I said, our regional Australians, our women in regional and remote parts of Australia, they already are facing additional and significant challenges in accessing medical and health services and support. This is no different with endometriosis. In fact, it's far worse. So these areas actually should be prioritised. They don't have all of the services that are available often in cities and outer metro areas. They are much more isolated. So I'm going to ask the government to please prioritise those regions outside of cities for pelvic pain clinics.